the treatment of mental health conditions is not working. We have more depression, more anxiety, more suicide, and more absenteeism because of mental health issues than ever before. And this is despite the fact that we have more practitioners than we've ever had. We have more funds being spent on research and development, and we have more pharmaceuticals to treat mental health conditions than we've ever had. And yet, instead of the decrease that we would expect, we have an increase in conditions. So something isn't working. And we need to look at the whole zeitgeist of treating illness, the medical practitioners and the mental health practitioners. And if we look at what's going on, we can see that we're living in an ever-increasing litigious society. So there's this fear-based initiative to cover all the bases, not to get yourself into trouble. And then we rely on the theory, which is also coming from this fear-based, how not to get into trouble, how to treat people and keep your back clean, not to get into any difficulties, or you could be sued. So make sure there's no margin for suing. And this creates a rather reductionist, limited way to treat our clients. If we want to inspire people to be the fullest human being that they can be, then we have to live and treat and be a practitioner in the fullest human being that we can be, because then they'll get it through the energetic impulse that's transmitted between two people. If we are busy thinking about the theory that we learned and how to stay safe as a practitioner with our client and how to avoid getting into any difficulty or disappointing the client so that they may take action against us, we really limit our capacity to bring all of what our soul has to help these clients in the treatment. So it's really important that we show up as all of who we are, with the fullness of love in our hearts for our clients, rather than a theory-based, how can I treat this person but not expose myself to any difficulties? And secondly, we really need to see all of our clients as their potential and not in that reductionist way where we treat the symptom and we don't treat the whole. If we're not seeing our client as the fullness of who they are, how can they possibly begin to see themselves as that? We have to hold that for them. And if we can bring these two elements into the treatment of mental health, the idea that we don't have to be safe, we can just be experimental, we can be creative, we can try what our mind, body, soul feels might work in this instance, rather than worrying whether this is a prescribed treatment or is there evidence-based research that proves that this would be a useful thing to do. We have to let go of that and actually show up in the fullness of who we are, with all of us being able to treat. There are two bodies in the room, and we want both those bodies to live in the fullness of who they are.